Today on the Empower LEP podcast, I talk to Dr. Christy Bock, who is the owner of Cornerstone Educational Solutions. It is a non-public agency, and she is an LEP, and she supports hundreds, literally, of school psychs and LEPs across the nation. And she's just a total visionary, and she's got wonderful energy, and I'm excited for you to listen to her story. Welcome back to the Empower LEP podcast. I have with me Dr. Christy Bock. Thank you so much for joining me.
No problem. Happy to be here.
Wonderful. It's great to meet you in person because we have just done a lot of like face without expression just on like a social media picture or something.
Absolutely.
So Christy owns Cornerstone Educational Solutions. And Christy, I would love to hear kind of your story and what your practice is all about, because I think it's really interesting from what I understand. And so I'm really looking forward to hearing this, just the path that you've taken and this practice that you've created and the kind of opportunities you're creating for others and how that can be something, like the point of this podcast is like, yes, LEPs, but also what else can you do in this field besides working for a school district? And so I think, you kind of have built something outside of that I'm really excited for people to hear about.
Cool. Very cool. Well, yeah, I definitely took unusual path to the whole LEP thing. I've actually been a LEP since 2008. So I was kind of one of those early, there's not a lot of people. It's so funny. I look at the LEP numbers, you look at the number and there's not that many people who are like older, which makes me feel very old because they don't have numbers before me. It's everybody's after me. So
are you a 2 or a 3?
I'm not. I'm a 3063. So I'm barely into the 3000s, but I know you don't see many 2s out there anymore.
Mm-hmm. I'm a 3272.
You're not far from me. What year did you get it?
I want to say 2010 or 11.
So you were a few years later.
Yeah.
Somebody I was in something with was a like 2 in front of me, and he got his at the very end of 07 and I was the very beginning of 08. I was like, oh my gosh. So anyway, we digress. Okay. So yes, I have definitely done kind of a unusual path. I've always been a school district psych. I've been a school district psych for 25 years. So I've been a psych for 25 years, school district as well. I taught for 3 years prior to that. I did the whole program at like 23. I was ridiculous. And I'm like, okay, I dropped out of the doctorate program because I'm like newly married and I'm thinking I'm not driving down to San Diego. So I started substitute teaching and I'm like, dude, I like this. This is so cool. So I started teaching. I did teaching for 3 years. And while I was a teacher, I realized that school psych was even an option. I had no idea there was such a thing. So I got pregnant with my first and ended up getting out of the teaching and ended up going into school psych. So that's how I got into school psych. And then I've always done work on the side. Even I started out working 40% because I had babies and ended up just going, doing side work for other districts since I would work part-time. And finally, gosh, in 2007, I realized LEP was even a thing. Back in those days we didn't know much about, at least I didn't know much about it. Yeah. So I ended up starting to explore the LEP, study for the test. I always heard it was such a hard test. And so I studied for it and I luckily passed it in 2008. Immediately when I was done passing my LEP, I was approached by a child advocate attorney in the courts. And they're like, hey, we had a mutual friend and they're like, we need somebody who can go in that can give judges recommendations for special needs kids because we have no one to do that. Like the judges don't know special ed. They know custody and those kinds of things. And the mediators that are mediating these cases, they don't know. So we created kind of this evaluation together and it was kind of more like a review and interviews. There wasn't like testing where I was going to sit down and like test the kid's IQ, but it was a really great evaluation. I still get requests for them here and there. I don't do a lot, but I would love it if other people from this like picked up on it and ran with it because it's such a needed area. and it pays well. So, but yeah, so basically I would interview the parents, interview the kids, do all of that. And I created this evaluation. We called it an educational custody evaluation. So basically would make recommendations to the judge. I sometimes would have to go on the stand, and that kind of got me used to being in front of judges and being asked, questions by attorneys and all of that. So I always knew I liked that area of it. But that work grew. I always did it on the side. I was always part-time until eventually my husband was retired medically from being law enforcement. And then I kind of went on full-time but still did side work. And so I started Cornerstone back when we first started, when I first was a LEP. And I started doing, just kind of calling it Cornerstone and doing work with private school parents and evaluations here and there. I still laugh at those evaluations, like how much I charged, because I didn't know what it was worth. I'm like, whatever. And so I ended up, growing that, got pretty known in the community. So I had a lot of work and not enough time to do it. But that just kept growing. And finally, I started seeing all this agency work, and I didn't really know much about it. So I did a little bit of agency work, and I was just shocked at how poorly ran. That sounds horrible, but how poorly ran they were. They were ran by people who had they barely knew special ed. They weren't psychs. They weren't doing any of that. And I was the only person doing psych work for them. So I finally realized I had a friend of mine who was like, you need to do your own non-public agency. And I'm like, well, I'm doing fine working for agencies. I'm making great money. I'm happy with it. She's like, you need to do it. She kept bugging me and literally kept at it. And I finally was like, okay, fine, just to get her off my back. I did all the paperwork, and it's a long process, DOJ, background of it. I mean, yeah, got to be cut out for going through that kind of scrutiny. But after a year, I was fine. I got my NPA, and I thought, okay, I'm just going to do the assessments myself. No big deal. But it just, all the places I'd already been doing work with for other agencies, they were like, we want you to do work for us. So we started growing and growing and growing. And I started bringing on some of my local friends that would be able to do the assessments. And a lot of it was virtual. So, and then it just kept growing. And so here we are, I think we're 3.5 years later, and I have about 170 plus psychs. We're in 13 states. California is our main, but we got a lot in Texas, Tennessee, Arizona. I mean, so we're all over the place. And it's just awesome. It's a great agency. I love the fact that this is most of our psychs. Well, not most, almost all of our psychs. This is their side gig. This is not their job. This is I need to make money to pay for all these extra things, or I want to pay off my debt. I want to do whatever. I want to pay for a car in cash. And so this is their side job, which is the vehicle to do that. And we're not like some of the other agencies that pay ridiculously low. I always said, if I'm going to do this, I'm going to pay psychs what they should get paid.
Mm-hmm.
We have a lot of education, a lot of different, I'm going to pay them well. So that's kind of how Cornerstone was born and my journey to get here. So here I am. So
wow. Well, I mean, I can't even imagine having a business in one place is hard enough. How did you even know the first thing about having, going through that non-public agency and then being able to open it in other states? There's so much HR, I don't know, how are you even doing that?
Oh my gosh. Honestly, I don't really know. I'm one of these people that just kind of do it and figure it out as I go. Luckily, I figured out California pretty well. And California, as we all know, is the toughest state of any state. So it was pretty much just downhill from there. I mean, if you figured out California, you kind of got the other ones going. And I also was in, there was kind of an organization that really liked me that has a bunch of virtual charters in other schools or in other states. And they ended up kind of bringing me into a bunch of states. So that helped. And then I've kind of branched out from there. But yeah, it's a lot. But if you've got California down, you pretty much have the rest of them. You're overboard and everywhere else. So it works out.
Gosh, I can't imagine on payroll being I support people in other states and like taxes and all the things. So kudos to you.
It's insane, but I luckily have people that do that for me now because I can't do it. I have
Right.
a full-time bookkeeper, money person, and she figures all that stuff out because it's just, we all have our strengths and weaknesses. And when I was running this by myself, I realized very quickly what my weaknesses were. And now I'm very well aware. But those, yeah, luckily I have people that do that now.
Yeah. Well, I'm even thinking about like all of the contracts that you do with all these different school districts and how crazy that must be. What's that been like?
Well, when you get into the non-public agency world, the contracts are uniform. So every district has essentially the same contract. So it's landing the contracts that's the hardest part. Word spreads, your name gets around. And so that's been a blessing because we've definitely had people who, we don't have to like sell to everyone now. Well, no, we still do. I mean, I still do email campaigns and such, but in general, word gets around. But they all have the uniform master contract for non-public agencies. And I definitely, I know exactly what it looks like. I know what it says, and they just kind of stipulate your rates and the different things you offer, and you sign it. So it's just not very hard. Outside of California, there's a lot of bidding systems. You have to go through this large bidding system. Some of the bigger California districts are requiring that now. But it's not, I mean, it's just a lot of hoops to jump through, but it's not that hard. So I just kind of jump through them and make it work. So
are they requiring your non-public agencies to have sexual abuse and molestation?
Oh my gosh, that is like the bane of my existence right now. I'm sorry, they don't offer like 3 million whatever on sexual molestation, which, by the way, as I know you clearly state all the time, it's a crime. You're insuring me for a crime.
Right.
Whatever. No, I can't. Not every district requires it, but almost all districts are asking for it now. And I've actually been successful in getting some of the districts that are like really stuck on the fact that we have to have this insurance. That I've gotten a few of them to say, to waive it. There's a waiver that they'll like, sometimes they'll waive the auto policy and those kinds of things. They'll let you waive that. And, but not a lot. And there's actually been a couple SELPAs that I have not been able to contract with because I don't have it and I can't get it.
Right. Were you contracting them with them before and then you couldn't anymore because now they're requiring this?
These were new ones last year. I don't know what's going to happen this coming year, but last year that I just couldn't get it. And I tried and nobody even offers that level. Like nobody does. So it was it's very annoying. So, but yeah.
Well, that's a whole other topic, but I don't even understand how
It doesn't make sense to me. And and the districts are jumping on the bandwagon really quickly, thinking that, oh, it's good for us to have these. But what they're realizing is they're handicapping themselves because they can't contract with great non-public agencies. They can't contract with LEPs. They can't contract with all of us. And we're the ones that they need. And so it's unfortunate that they're kind of handicapping themselves by requiring this, thinking they probably are doing it in like as a good thing, but it's not. They don't understand what it is. And that's frustrating.
Right.
Yep.
Okay. So as a non-public agency, you have, 100 plus psychs.
Yep.
And they are contracted with your agency.
Correct.
And so what do they have to have in place in order to be an independent contractor? Okay.
They have to have liability insurance that conforms to the whatever the requirement is, which is usually $1 million, $3 million. So that's all they have to have. I have to have all kinds of other stuff, but they have to have just the liability. And then they're 1099. So they're, they have the 1099. They get to, write things off. Some people will have an LLC and like maybe a LEP that is doing work with me. They might have an LLC. And so then they can write things off. So, but really the only cost of doing business besides testing stuff or whatever, MHS, Q Global, those kinds of things is really just the liability insurance.
Okay. And then, so they have to have their own testing stuff.
Yeah. As an independent contractor, you have to have your own testing stuff.
Right.
A lot of the like Q Global has made a lot of their stuff virtual. So that does help a bit, but it is definitely, for the most part, you have to have your own testing supplies. And I always say in a lot of the populations that we work, especially when we're doing the virtual evals through like some of the virtual schools, please don't think you're going to be able to send paper and get it back. You have to do the links. You can't, you're going to be doing MHS, Q Global. You can't send, a Basque and be like, here, deliver it and send. No, it doesn't work that way. So,
right.
Yeah.
That's so interesting. I've never done a virtual assessment before.
I love them. I love them. They're so great. They're like, I enjoy them. And honestly, to tell you the truth, when I sit down with kids virtually, I can keep their attention better than I can in person. It's crazy.
Huh.
I don't know. I love virtual, and I love that the field kind of evolved during COVID, where it was more readily accepted. There's some kids, like we'll have our psychs will start testing a kindergartner, and the school's saying they could do a virtual, and we're like, you sure? And they sit down with them and they're like, oh no, this has to go to in person. And luckily our schools are cool with that, and they'll change it to an in-person, and then I'll try to find a psych that's closer to where they live. But yeah, for the most part, a lot of the kids, SLD, OHI, ED, even really, you can test virtually.
And so, if psychs have to like travel, do they just pay their own travel?
They pay their own travel. They do, mileage. So they get mileage. All our schools pay mileage. That's part of our contract. If I have grouping, so we have a lot of Bay Area assessments. I do stipend some of the ones that come from Southern California and go up to Northern California to take a large grouping. Like they'll come up and do like six in one little stay just to get them done, because it's great money. And then you go write your reports on your own time. All our IEPs are virtual. So they basically, I will stipend them a little bit for a travel stipend just to kind of help out with them coming up, because Southern California isn't nearly as busy as Northern. So
Got it.
Lots of contracts up there.
Yeah. Because we need more school psychologists up here.
Well, and it costs an arm and a leg to live in where you guys live.
Right.
So it's psychs can't make enough. So yeah, but, and also, there are definitely, we have a lot of psychs up in your area, but it's just the needs are just, so that's why we send our Southern California psychs. It's kind of nice.
What do you think are some of the biggest differences between work, if somebody wanted to come to work with your agency versus a different agency?
Well, other agencies pay horribly. Like that's one of the first things I'm like, are you kidding me? Like, of course I looked into it back in the day. Well, I love that we have a group of, a lot of psychs, that we have kind of a thread going where people can ask questions. I mean, you're getting some really, really experienced psychs weighing in on your concerns, or and that collaboration piece, a lot of the psychs really, really enjoy that. I love it. I think it's great. I'll read the threads and I'm like, that's interesting. It's just, there's a nice grouping of collaboration. There's work. That's the other thing, is I have a lot of contracts. Most of my psychs right now are so overloaded, they can't take on anymore. There's work and there's money to be made. I also have a lot of LEPs who are doing work with me. And so we get private assessments, we get a lot of IEEs, and those are higher paying assessments. And so it's nice because it gives the opportunity to maybe the LEPs that don't know that they want to start a business or run a business, because there is it's a lot. I mean, a business, when I had to make my first payroll way back, however many years ago, I'm like, wait, what? Like it was insane. So some of the psychs are not wanting to do that yet, or they want to kind of get their feet wet. So this is a really good opportunity for them to, do the private evals, do the IEEs, learn how to do them. I mean, I definitely try to mentor them to an extent, because I've been doing all that stuff for years, and, give them the opportunities because I get a lot of opportunities.
Right. And I think it's important for people to know. And that's why, like I said, I'm excited to have you on here, because business ownership, like just because you have your LEP doesn't mean that business ownership is for you, and so tell me like some of the hardest parts, I guess, of being a business owner, and also some of the awesome things about being a business owner for our listeners.
So, man. Okay. So hard parts.
Yeah.
Well, you're owning a business, and we're psychologists. And I don't know how many of you guys were, like, I'm going to be a psych and a business owner. It's a lot. And, like I said earlier, I really found out very quickly what I was good at and what I wasn't good at. I am not, I'm going to run. I mean, it was so funny when when my accountant started with us, or she's the does all bookkeeping, payroll, all of that stuff. She's like, I'm like, so I have no idea when people pay or how, if they've ever paid, because I don't keep track of any of that. And she's like, wait, what? I'm like, so she's found a lot of money that I didn't know I was missing, which is great, but I'm not good at that. I am not good with that kind of stuff. The numbers stuff is just not my forte. Systems aren't my forte. I kind of did the best I could with what I had, but since bringing on the right people, we've now built this internal portal where districts put their assessments, because we're an overflow agency. We're not a you have a person out in your district and I'm going to come in and be the psych at that school. My psychs work. They're all working psychs. So we are overflow. We are maternity leave, and you need to keep up on your assessments. We're that kind of a thing. So, keeping track of and we do like anywhere between 400 to 500 assessments a month. So, keeping track of those assessments as they come in is very difficult.
What may I ask, what do you use? Like, what kind of portal do you use for that?
We had to have it built. We literally paid a web designer and built and spent the crazy money. I'll show it to you sometime, Jana. You'll be like, what? That's impressive. Wow. I'm like proud of it because I spent so much time and money on it. But we had it from the ground. It started through Monday.com and then went from there to there to there to there. And now it's just completely outside of that. And it's its own entity. I do end of the year meetings with all my school districts. And I just had one today, right before this. And they're like, we love your portal. Your portal is wonderful. And it really is awesome, but that's a lot to keep track of. So I realized that, I had to also spend a lot of money in an effort to make the business run smooth. Besides personnel, besides my people that work for me, that's insane amounts. But, I had to spend the money on the portal and all of that. So, some of the hard parts about owning a business is all that stuff, all the stuff that you're not naturally good at. And it wears on you, you guys. It's like, I was, for the first couple of years of this business, it was like and like I said, I have a bunch of kids and I have a husband that's like, I'd like attention here and there. And it was very, very hard to do that because I was consumed with having to, I close up my other work and I pull out my business work. And so it was challenging, but the pros of business ownership is, I started this as a way to make money. I needed it to, pay for kids' college and pay for dance and hockey and all these crazy things. And we all know that, school psychs, we don't make the best money in the world, especially for our level of education. What I've realized over the years is it's kind of evolved from the money piece, which of course money's great. And yay, we get that. That's been less of my focus. What I really love about what I do is I get to see psychs who a lot of them are like, well, I'll join a multi-level marketing or I'll do this and I'll make an extra $500 a month. And I'm like, no, you have all this education and ability. Let's do this. And so giving them the opportunities to make meaningful money. We're not talking about like, a little bit of money, meaningful. And the harder you want to work, the more you because there's always work available. And so giving those psychs the opportunity to put themselves in a better financial position, to be able to pay off debt, their student loans, pay off their car, save for a down payment on a house, whatever it is, pay off their house. I've seen it all. That's like what I love about my job. I love seeing them, getting texts and saying, hey, Christy, I just paid off my last credit card. Yay. Thank you. Thanks for the opportunities. That's the stuff I really love. So, it's kind of morphed from, of course, money's important and, that's all cool, but man, I love that opportunity. And I love what we do for the districts. The districts, we problem solve. We get into we have a couple little rural, Northern California districts that are crazy busy, crazy sped numbers, like 30% sped numbers. And sitting down with them at the beginning of at the end of the previous school year and brainstorming, what are we going to do? How are we going to make this happen? Because they wanted to work with us. They couldn't keep psychs. So we literally sat down and brainstormed and we figured this out. And they were like, this has been the greatest thing ever, that we're now doing it with a couple other districts now. So I love that problem solving aspect, being able to offer and tailor our services based on, what they need. So.
Yeah. Do you ever feel like are you ever like, oh my gosh, I don't have enough psychs and I have too much business and what am I going to do?
Are you kidding me? Every day.
What do
Like
you do?
I put I advertise on Facebook. I'm like, hey, Facebook,
Yeah.
I'm not kidding you. Like
Yeah. I've seen it.
I know you've probably seen them.
Yeah.
I definitely try to use the psychs I have because they always say thoroughbreds run with thoroughbreds. So you've got great psychs, and my psychs are awesome. They're experienced. They're great. Good psychs have good psych friends. And so I want those friends. But every once in a while, I have to put out an ad on Facebook just to kind of say, I've got some immediate needs in this area. Is there anyone available? And I usually find people that way.
Mm-hmm.
I need high up Northern California, by the way. Anybody out there? High up Northern, like way up there. I need some help. Anyway, they're really, we have basically, I'm able to get them. I don't know how. I always am the type that I get the contract and then I find the psychs. And I know that most people, I somewhat not very like worrisome. I don't know how I do it because I get questioned about it all the time, but I'll find the contract and then I'll find the psych. I'll make sure we have the psychs for it. I'm not going to turn business away.
Right.
So
Right.
it works.
Yep. So when somebody onboards, like what's that process like for them, and how do you vet them? Like, how do you know that they're going to do a good job to represent your company?
Well, the beauty of 1099 work is if they don't, you don't give them work. So that's the beauty.
Yeah.
We go through the typical send us a resume. Usually I'll talk to them. I'll get on the phone with them or I'll Zoom with them, kind of get a feeling for them. There are those people. And honestly, I wish I would follow my gut more often because there's been a few times where I'm like, I didn't feel totally easy. And then they were a mess. And, there was some mental health challenges and those kinds of things. But I got to tell you, for the most part, I end up doing well. I don't know how. One of the things we put into place is we have Lila is our main lead psych, and then Cassie is coming on to help out with that as well. And she's all the things I'm not. I am not super, super detail oriented. I'm like big picture type. She is, and we make sure that we are reading the first 2 reports that come through from a psych to make sure, and we really guide them. We want to make sure that, look, you may not be super strong right now, but we're going to get you there. But after we've tried and they're still not responding, they just don't get the work. And, but if you are good, man, you have more work than you know what to do with. So, yeah. So we just do that.
Yeah. Nice. Gosh, I have so many questions. What do you use for your internal, thread that you're talking about? Like, do you have do you use Slack or email?
Oh, next year, Slack. We already have it all set up. That's going to be our next year thing. Actually, our web developer was the one who kind of said, hey, we're going to now communicate on Slack. Cause I think we were blowing up his texting and email. And I think he was sick of it. So he's like, let's go to Slack. So, we're going to do that next year and kind of let people opt in if they would like to. We got to do something because there's so many of us on these threads, but we did make an official thread for all questions, and psychs use it. They use it all the time. They'll say, hey, I've got this kid that looks like this. What do you think I should give for that? And people chime in just like you would on Facebook, but it's just a cornerstone.
Right. Right.
Yeah.
When did you stop doing evaluations yourself, or do you still do them?
I have some big clients that I've had to stay with. I didn't really want to because, I don't want to say I don't love testing anymore, but anyone who knows me knows that's true. So I'll be totally honest. 25 years, guys, 25 years.
Yes.
I'm done. How many times can I give vocabulary and similarities? And my goodness. But I still will do testing here and there, not for the business. This is all side stuff with clients that I've had for a long time. Just when they need to have reevaluations and stuff done. I don't really do that much anymore. Mostly it's the psychs that do it. I do a lot of reading reports, lots of reading reports, because I've gotten more attuned to what I need to look for and where I know that some psychs struggle a little bit more. So I could give them some really, meaty feedback so that they can kind of improve if it's an area of concern. So yeah, not really. I don't really do much. Yeah. I do a lot, but not testing. There you go.
Right. Well, right. I mean, so it sounds like you've really become like business mogul.
You have to. when you mogul, I wonder, I wish, when you have a business of the size that this has become,
Yeah.
you have to, yeah,
Yep.
have to, you are, and the district maintenance is insane. I mean, you cannot, because in some districts are more tough than others. Some are super easy and others are like, we read the report and there was a she instead of a he. And we're like, oh, like no psych has ever done that before. Like, come on, then fix it. It's not a big deal. Like you got a Word doc there, you can open it up and change. Anyway, sorry. It's one of those things that, yeah, district maintenance is hard. There's a lot of that. And that's the thing. You get a lot of, questions, you're constantly communicating with them. Luckily I have Lila and Michelle and Ray. I mean, I've got all the people that can also step in for the money side of it or for the portal side of it or for whatever side. But there's a lot of district maintenance that we have to do. So I do a lot of that. The maintenance, seeking out new psychs. Luckily I don't have to do the onboarding anymore. We have like 2 phases of onboarding. We have like the paper onboarding, portal onboarding, and then we have the psych onboarding. And, they are independent contractors. So, it's just a simple kind of explaining how things work, but we're always available. And that's the beauty is, you can text Lila at any point in time and she will always respond because she's just like that. So it's good.
Yeah. So like, as people are thinking about venturing out potentially out of school districts, like, do you have anybody who works for you full time, like, or not, like who doesn't work for school districts and who just works for you?
It's becoming way more popular. We have a lot of psychs that are starting to leave the school district and only do this contract work. They make a lot more. That's just that it comes down to it. If you think, whatever, they can do well with it. It gives them a lot of freedom. I mean, because you just plan your assessments. My sister is a psych and she's been a school district. She doesn't really have to work, but she wants to work to keep her brain busy. And so she just works mostly from home. She does mostly virtual assessments. She absolutely loves it. She goes, to the store anytime during the day. She wants to go shop. She has the ability and the flexibility to do that. That's the beauty of it. But I have a lot of psychs who work part-time in the district and have freed up a couple days a week to do the work with me. And I have many psychs now that are starting to only do the contract work. They're leaving the districts altogether. I have quite a few in other states as well, because I kind of pay like California rates. And when you're in like Kentucky, it's kind of like, wait a second, you pay what? And I remember thinking, gosh, am I overpaying all of these? But whatever, they're doing a great job. So so lots of psychs that have left or are part-time. It's a great gig. Yeah. The having your benefits, if you need benefits through the school district, and then doing this on the side. Oh yeah, you may have to pay for part of it, but you make it up in no time. So
yeah. I mean, so what are some maybe pieces of guidance or advice for people who are considering something outside the school districts? And, what are some good times for them to maybe like venture into an opportunity where they're still, like where they don't have to do all the business aspect, right? Yeah. Like this, or, like, what do you think?
I really encourage my psychs to get LEPs. In fact, we have a LEP bonus. If you take the test and you pass, you get a bonus like from us, just because I feel so strongly that it opens up so many doors. So I want psychs to be LEPs. Like, I think it's a great idea. 1, I can use them for private evals, which is great. But 2, they have that flexibility of they could eventually venture out. My word of caution would be, don't do it too soon. Don't quit your day job and think the work's going to just fall from the sky. It doesn't. You have to be like, I do mostly sales now. I am mostly doing. And if you're not a person that likes to go up to people and make phone calls and emails and those kinds of things, it's going to be challenging. So I would definitely say, don't leave your day job until work full-time, building it up. And then when you get to the point where you can go down to part-time, go to part-time, build it up until the point where you can then make that jump. I know that some people just, think it's smart to just jump into it and you can go full force, but you might be without a paycheck. That's a little scary. So or you could always try it out. you could do work for an agency like mine or any of the other ones out there and see if you like the side stuff. If, I think most people end up loving it, but, try it out, see if you like it. And then if you really like it, then increase by doing the side stuff with the agency or without the agency. And then to the point where you then can jump full force into it. But don't do it too soon. That always scares me when I see on the Facebook threads and they're like, I'm going to quit tomorrow. I just got my LEP. And I'm like, oh, please don't do that unless you're like, don't need to work or something. Cause that's scary. So yeah.
Yeah. Cause you really just, there's when there's no safety net, it's pretty scary. And you're not just like, oh, I'm just going to do assessments. I mean, also like there's a difference between whether you want to go and work for school districts, right? But outside of being employed by the school district, but you want to have contracts with school districts.
Right.
That's different than I want to have private practice clients and do private practice work, because that's like a whole different ball game. You can't give them a school psych, like an ed code report and think that that's going to cut it,
No, you have to do a lot more than that. But if you want to contract with districts, I mean, like most of our work is in the schools.
Right.
So you're still going in the schools, you're still collaborating with a team, which a lot of psychs that want that still, but they don't want to be, sitting in there trying to write a report or test a kid and all of a sudden get the call of a freaking out kindergartner that they have to go run to because they've never been in school and that, you know what's going on right now. So that's the difference. I was over that, like I could get, and what does that do? You take your work home. Now you're burnt out. I mean, I can't tell you how many psychs I see within our field leaving. They're either leaving or they're trying to find another way. I think that's one of the reasons why the LEP population has grown so much recently, is because there's so many who are so burnt out from the school district. And I don't blame them. Right. It's a lot. And that, expecting them to do, 80 to 100 evals a year. And how can you do that? And so whatever the case, it's, and do all the other responsibilities that they have. So, I just feel like a lot of psychs are looking for something different. And I think that's awesome. Yeah. It's great, but you just need to do it with measure. You need to make sure you're not just diving full force and that you have a step plan of how you're going to make it happen.
Right. Right. Absolutely. Well, gosh, this was inspiring. This was a great conversation. I just love talking to people who are doing something that's even just different, different. And you just it's like you built an empire.
Well, I definitely built something. I don't know if it's
it's so cool. It's great. But you definitely have that type of personality. I can tell, where you're just like, you're a go-getter and you can talk, sounds like you can talk to anyone, and you'll call up the director and you'll be like, hey, this is what we have going on, and I'm not afraid to share it with you.
I want them to know. I honestly feel like what we offer to districts is unique because we can make it what they want it to be. And so I believe I really love what I do. I really love Cornerstone. I love our business. I love LEPs. I love being in this world. It's definitely one of those things that I'm well suited for this part of it at this point in my life. So right. I think that that's why this is working out so well. And I love mentoring new psychs, love mentoring new LEPs. That kind of stuff is so much fun, just so much fun. I love it. So
yeah. Well, if somebody is listening to this and is like, you know what, I think I want to go work with Christy, how do they contact you?
You could email me. I'm Christy, CHRSTY at Cornerstone Educational Solutions with an S. That's my email. You can always get me through the website, which by the way is going to be redone because it's super old. And like, I never think about those kinds of things, having to start thinking about those things. But yeah, welcome to reach out at any time. We always are needing new psychs. We're always needing them all over the state, northern more than southern, but we always are needing people. So yeah.
And you can be a school psychologist. You do not have to be an LEP because you are working, you're an NPA and you're in schools as a school psychologist.
NPA is kind of like its own entity.
Yeah.
So you only have to be a credentialed school psych. If you're a LEP, great. We can, definitely we have LEP work, but most of our work is the school district stuff. But yeah, you just have to be a psych.
Yeah.
It's a great opportunity.
And where do you live? Like, where are you actually located?
I'm in Southern California. So I'm like outside of LA area. I have
Where?
Altaloma, Upland.
Yeah.
Okay, Claremont. Everyone knows Claremont because of the Claremont colleges. And
Well,
I think
no, Upland, wasn't there like an earthquake there? Upland?
yes, years ago, my
Mhm.
husband was riding his bike when it happened, and it like oh, it was funny. Sorry, I digress. But yeah, there's definitely been a lot of that. We're right at the base of the like what I'm looking at right now outside of my sliding door here is the mountains. There's nothing behind us, so we're like right up against the mountains. So we're kind of east of Pasadena.
Okay.
So yeah, so we don't have a physical location. I'm virtual. So 100% of, I never went out and got an office. I never did any of that because everything we do is just around the state. So I pretty much work from home and I love it. And so, too many years of going in, having to get dressed and put on heels or do all that. Now I wear sweats and I make the upper half look somewhat
Yeah,
nice.
I was going to say, little do they know you've got your yoga pants on.
Oh yeah, every day. So anyway, yeah.
Awesome. Well, thanks so much for joining me on this episode, Christy. I learned so much from you.
Problem anytime. Happy to be here.
All right. Thanks. Thanks everybody for listening again to the Empower LEP podcast, and we will see you soon. Thank you for listening to the Empower LEP podcast. Episodes can be found at empowerlep.com. If you liked what you heard, please leave a 5-star rating and review on your favorite podcast player. If you'd like to be a guest on the show, or if you have any questions for me, don't hesitate to connect. I would love to learn more. I can be found at jana@empowerlep.com.